As technology and innovation have embedded deep in the healthcare field, hospitals and startups have found more feasible and connective ways to improve the offerings and revolutionize the industry. The result is amazing. Application of new technology and thought process that can forever change how patients are treated. Hello everyone, this is Anshu Jain from Qatarday and welcome to yet another fascinating episode of Qatarday Presents Startup of the Month, a distinct series showcasing startup success stories brought to you by 360 Nautica. Home remedies were once in trend, but to have a genuine doc at home is what the medical world has fresh to offer us. And joining us today on this momentous episode is the man who brought about this innovation, the founder and CEO of At Home Doc, Mr. Hesham Elfeshawy. Hesham, it's such a great pleasure that you've agreed to be a part of our show. And thank you so much for sharing your valued time and experience with us.
Thank you very much for having me. It's been a great pleasure. Thank you for this invitation. I'm happy to be here.
It's completely our pleasure.
Thank you.
Hesham, known for its innovation solution, At Home Doc, the first mobile app that brings doctors, laboratories, and medical services to the patient in less than 90 minutes, and that 24/7.
Yep.
We would want to know more about it because it sounds really fascinating.
Thank you very much for the introduction. Actually, At Home Doc is simply, as you just mentioned, it's an easy way to access healthcare. We all need doctors. There is no doubt about it, whether it is for prevention or it is for we're not feeling well and we just need to be seen by a doctor. In fact, it's been challenging for everyone to see a doctor when it comes to non-emergent medical conditions. You have to drive your car, go to a clinic, wait in the congested waiting room. Sometimes you go to the emergency department if it's too late at night. And we found out that At Home Doc actually fulfills the need of the people when it comes to primary care. You can easily now book a doctor, see the doctor at home in no time, and pay the exact same cost that you're going to pay at the hospital. This is At Home Doc. And the medical practice wouldn't be an exact or a proper medical practice without being integrated with other services needed for evidence-based medical practice, such as the laboratories, as you just mentioned. And the lab is a tool that doctors use to reach into the proper diagnosis.
True.
Accuracy of the diagnosis plays a major role in our well-being. So if we got diagnosed incorrectly, this impacts our health. Doctors need to use labs, and that's why we offer the laboratories at home as well.
At home as well.
And the main reason we call doctors is actually to receive treatment. So without the pharmacy, this wouldn't have been a successful end-to-end experience for a patient. And that's why we brought the integration with pharmacies as well.
Pharmacies as well. So it's a proper concoction, or I can say integration of doctors, laboratories, and pharmacy. The complete service altogether, which would be provided to you at your home, 24/7. Right? Now, Hesham, you guys claim to be the licensed service provider. Now, when we say licensed service provider, I would want to know, like, who are the doctors? Are these the practitioners who are working in various healthcare facilities out here, or the owners of individual clinics? Who are these doctors?
To answer this question, we have to understand that healthcare is a different industry than logistics, for example. So people usually, when we say that we bring doctors to your home, they refer it as you are the Uber of doctors. You can't be the Uber of doctors, because when you book a car or a taxi, you don't build a relationship with the captain. However, when you book a doctor, you need to build a relationship, and there is a trust factor that needs to be there. And you can't engage with patients and gain their trust without being a recognized facility. And that's why At Home Doc is a licensed facility by the Ministry of Public Health in Qatar. So we're registered as a facility, and we've recruited our own medical team from licensed doctors, licensed nurses. And that's how we approach and how we see the healthcare needs to be addressed. It can't be just an Uber-like. It has to be associated with a trust and associated with regulatory requirements and be fulfilled in order to guarantee the best healthcare outcome to our patients and reduce any liabilities on us or our investors.
This is very true. When you talk about doctors, the most important factor here that would play a crucial role is the trust between the patient and the doctor. So you have got your own team of doctors.
That's true.
Okay, great. But I would want to know one thing here. When you talk about providing the services at home, you know, like as per the convenience of the patient or of the customer, but there are certain services that cannot be provided at home.
That's
we
true.
talk about the X-ray or, you know, multiple more requirements are there in terms of medical terms, which are really critical at times. So what about those services? Do you guys offer that as well?
So to answer this question, we have to understand the healthcare, how it works. The healthcare systems are basically 3 tiers. So if you look into the base of the pyramid, if you envision that the healthcare system is a pyramid, the very first step is called the primary care. And in the primary care, it's the lowest cost service that can be offered to the patient with the highest impact. And then comes the secondary care, which are the hospitals that patients needs to visit or needs to have a surgery, for example, or do more in-depth investigations for certain scope of practices. And then you have the top of the pyramid, which is called the tertiary care, which are the chronic patients or those who need special needs or needs to be treated for long periods of time within the healthcare ecosystem. So at-home doc is basically focused on the primary care.
All right. Okay.
So we usually state that we are a primary healthcare provider rather than just a healthcare provider. We are very focused on this particular part, which plays a major role on the efficiency of the other 2 parts. So if you have a solid primary care, you can definitely control your costs, because studies have shown that if you have a primary care provider for yourself, rather than picking a specialist at the secondary care. For example, if I'm not feeling well and I believe that I need to see a cardiologist, if I book an appointment with a cardiologist, that's a specialist in the secondary care, not in the primary care. So the studies show that people who choose to have a primary care provider spend 33% less on their healthcare over the lifespan. And they have odds of living longer by 19% than those who choose to go to a specialist. The US alone would save $67 billion a year if each and every American get a primary care, rather than just picking a specialist at a hospital and visiting a hospital, congesting the waiting rooms or the emergency departments for no reason. So this is how sophisticated the economics and the healthcare is related to the practices. And when we are very focused on what we do is the highest value proposition, because when we look at the primary care, it does not only start with seeing the doctor, it starts with promoting a healthy lifestyle, it starts with the awareness and other many factors rather than just seeing the doctor. So we practice clinical guidelines in the primary care that is based on the Australian system and the local system. So we don't deal with clinical conditions that requires clinical sittings. So in order to maintain this, we have a process in place. We call it the medical triage. The medical triage is like a sorting of the severity of the condition. So we recruit licensed nurses, we train them, and the first point of contact whenever you call for a doctor or book a doctor is that you get to talk to a medical staff who's trained on the medical triage scheme, and this staff will identify whether you need to go to the hospital or you can be seen at home, depending on your condition and on the clinical guidelines.
So the initial diagnosis, which is
not the diagnosis, it is about identifying whether you are an emergency or you're not. So if your condition requires clinical sittings, you will be advised, and that's for free, that you need to drive to the hospital or you need to book an appointment with the hospital or go to the emergency. If not, then you probably get a confirmation or your appointment and you're going to see the doctor at your home.
That's wonderful.
Or via the video consultation.
So that's amazing. So you provide video consultation as well.
Yes.
So apart from the in-house facility or the service that you guys offer,
True.
you have got video consultation as well. So if
Yeah.
any of the patients is wanting to have the video consultation with the doctor, they can just do that as well.
Yep, true.
So that's wonderful. But when we say that, the prices in terms of medical industry, not just here in Qatar, but
Yeah.
everywhere around, it's pretty expensive. How cost effective you are in terms of services that you are providing, especially
Yeah.
it's at home?
Yeah. So that's a very good question, because healthcare is associated to cost, as you just mentioned. And this cost is the payers are the ones who are suffering. So the payer could be the patient, could be an insurance company, and could be the government. So payers suffer from different factors. One of the most factors are the misunderstanding of the importance of primary care. So the primary care, as I just mentioned, should not cost a lot,
True.
because you're only paying for consultations. What actually increased the cost is the overcharging and overbilling, and the abuse that happens to the payers through other practitioners or other facilities. This happens when you are overprescribed medication or overprescribed investigations, and this can only happen when you go to a secondary care. So the primary care is the cheapest way to approach care, and to maintain the price, we are pretty much focused on what we do.
Okay.
We're not into selling investigations that you do not require. We only require the investigations that are proper to your, we call it provisional diagnosis. So if the doctor finds out that this could be, let's say, probably a pre-diabetic patient and who's suffering from those kind of symptoms that indicates that this patient would be a diabetic patient in the future, then that's only when the doctor will prescribe this investigation. We don't do, and that's controlled by the clinical guidelines once more, which is something that we are automating in our back-end systems.
Got it.
Yeah.
That's pretty much clear to me. So the prices are very much reasonable, keeping in mind the service that you are providing at the moment is related to the primary
It
care.
is exactly in the same range of hospitals and clinics' primary care.
And that
So-
you're getting the services at home.
And that's and you're getting it at home, and that's how we got licensed. When you apply for a license, you have to provide a price list, and your price list as a primary provider has to be within the market range.
Very true.
So we are offering it at the market range. And by the way, we have deal with insurance companies and deals, and they are paying us for the primary care at home. This wouldn't be possible if the cost is not affordable and convenient.
It's very true.
Yeah.
That's a wonderful thing to know.
We
Now,
have
but
memberships
what-
as well.
Oh, you have got memberships as well?
Yep.
Okay.
Yeah, the memberships are for those who don't have medical insurance and would like to save more on their health care needs. We have a membership card called Doctori, which is my doctor, my family doctor. Doctori card from At Home Doc. The Doctori cards actually gives you 50% discount on the consultation, and whether it is a video consultation or a home visit.
All right. So
Yeah.
in case you don't have medical insurance, so I would want to know, when you're talking about medical insurance and all, so all those people who have got medical insurance, is your service covered under the medical insurance as well?
Yeah, so there are two ways here we're managing this. Whether it is through direct billing, so if I have a deal with your insurance company, you probably pay your co-payment or those fractions of the transaction, and the rest will be billed directly to your insurance. And this is this is being done here in Qatar with Al Qut Medical Insurance as we speak. So Al Qut Medical Insurance Company has about 160,000 lives where they can access the service cashlessly. Other insurance or other members of other insurance companies can pay us in cash, and they get reimbursed for their consultations through their insurance firms directly. And they are about 60% of our patients on a daily basis.
Okay,
Yeah.
okay. So both can avail these services.
Yes,
So the people
yes.
who have got insurance at the same time who are without insurance, because if
Can
you don't
pay
have
in
any,
cash, reimburse their money
Yes,
back.
Exactly. That's wonderful thing to know.
And that's what's been happening for the past 3 years, by the way.
Okay.
Yeah.
That's great. So it's been like 3 years that you're already in the market.
In Qatar,
That's
yeah.
nice.
Yeah.
Great, amazing. Hesham, I would want to know one thing. Like, medical industry is one such sector which is booming.
Yeah.
Right? Tapping into this industry. You come from a field which is into technology. You are not a medical sciences student,
No.
if I'm not mistaken,
I'm
right?
not.
And at the same time, getting the concept, coming up with the concept of at-home doc.
Yeah.
Where did you get this idea from?
So two factors when you jump into the unknown. Okay. So you gotta have the passion, and you don't actually. The passion doesn't come to you, or you don't know what you're passionate about unless you look for it. And I think I found that it's like a calling, and when you find out that this is a great idea, and you're passionate about it, and you don't feel like you're working when you're doing it, that's when you really have a passion. And the second thing is to have a good team, a co-founder who has a complementary skills. So my co-founder, my twin brother, Dr. Hatem, he's a doctor.
Oh, that's wonderful.
So we have the tech part, the logistics part, and then we have the business part and the understanding of the medical field itself. And that's how you complement your idea before just jumping into the unknown without making calculated risks. So you gotta be ready for definitely to take a punch or two while you're doing this, but you gotta be nimble and robust to get back and find ways to get there. And we've seen an opportunity that no one is doing it, and we've seen that we have complementary skills that can help us achieve this, and that's why we've done it.
That's how. So we can see that technology and a speciality coming all together, and we saw the magic happening. Wonderful. All right. Now, startups are known to run on funding spree, right? So apart from receiving the support from incubation programs and QBIC, QSTP, and QDB, where else did you reach out to get the support in terms of investment? So which other entity?
So we have a huge list of not a huge list, but it's a big list relatively of investors and people who supported us during this journey. But entrepreneurs need to understand that you can't just go and approach those people without proving your concept. So you're gonna find ways before you approach incubation centers or investors, because simply those investors and incubation centers are seeing thousands of ideas every day and thousands of companies every day. And if you want to step out of the crowd and be clear that this is the company that I want to invest at, you're gonna be different. You're gonna show traction, and this requires personal investments, whether it is time, whether it is money. So you're gonna do and believe in what you're doing, show some traction before you approach them. Talking about who's invested with us, we have 500 startups from the Silicon Valley. It's actually the first investment that we received, 500 Falcons, which is a program run in the Middle East by the 500 startups. We have seed stars from Switzerland, QDB, as you just mentioned, as an investor, and 360 Nautica, Doha Tech Angels lately has joined us, and a handful of very good investors that are adding value to us. And you have to look into the investment not only as cash, you have to look into strategic partnership, whether this investor will add to you more than cash, because cash, I'm not saying that cash is easy to get here, don't misunderstand me, but there are more values rather than cash that you need from the investors who are coming and joining you. You have to be very careful, because it's like marriage. Once you have the investors in, you got to be certain of what you're doing, and the due diligence works both ways.
True.
So you need to be ready for the due diligence, and you need to have your own homework done before you go into any partnership. Yeah.
That's wonderful to know. So how excited you are about your association
Very.
with 360 Nautica and Doha Tech Angels?
We're very, actually, this is something that we're very happy and excited about. We see a huge opportunity here that we can tap untapped market for us. We see that 360 Nautica is actually a comprehensive knowledge of the market coming from different brands that Dr. Singh has experienced himself in building brands in Doha, knowing the market here, tapping segments that we not necessarily are serving at the moment. So we see a huge opportunity with us with the learnings because learning is one of the key success factors. If you want to be an entrepreneur, or you want to be recognized as a founder, or you want to start something, you're gonna be knowledgeable of what you're doing. You're gonna be you're gonna study hard. You're gonna learn so fast, but it's a paradox. So when you learn everything about what you're doing, that's when innovation stops.
Sure.
So you gotta still have this challenge. You gotta still have this beginner's mindset, and this only happens when you join hands with others who can challenge your business model and tap untapped market and experiment new things. And you got to be ready for the experiments, because experiments by its nature are like the odds of failure is very high when you experiment new things, and you got to be open for this and ready for this and keep trying until you find the successful experiment that you need to keep on repeating every day. And that's it. So we're very excited and very happy and very ready to actually to start experimenting with 360 Nautica, unleashing new potential for us in the local and the regional market.
So getting the right partners is crucial to the success of any venture.
Exactly.
Absolutely.
Yeah.
Wonderful, wonderful.
Yeah.
Now, one question, probably the one
Still have
last
time.
question.
Okay.
So we do have time,
Okay.
definitely. Right. So one question that I would want to ask you here is, you must be aware that millions of startups, they emerge every year.
Yeah.
But only a portion, or I must say just less than 1%,
Yeah.
are able to survive. I'm not even talking about thrive here.
Mm-hmm.
What, according to you, are the key principles that any budding entrepreneur should be following to ensure the startup is able to survive and thrive?
Yeah. So main factors, definitely, there's no clear roadmap for a startup, for all the startups, that this is the steps that you need to follow to survive. Definitely there are odds and different possibilities for every and each business model, and things change really fast. So, but there are certain things that you need to bear in mind when you tap into entrepreneurship. You gotta live in the future. You gotta work in the future, and be very fast and robust about what you're doing. You're gonna lean into the future rather than having the future leaning back on you, because every time you wait for the future is gonna win, not the entrepreneur. So you gotta have this futuristic mindset, meanwhile having your feet on the ground. So this only happens when you have a proper team in place where people are experimenting new things, living in the future, envisioning, creating a future, and having the patience, because timing is everything. So usually a good entrepreneur will have will be futuristic. Will have a vision, seeing things how would be in the future, but meanwhile having a solid ground to step at, and taking baby steps every time to get there, and get the people with him to the future. Because it's not that the future is happening; it's happening because we are making it. And I believe that entrepreneurs are the reason life improves. If we're not doing it the right way, we'll probably not be able to communicate how we see things for the people. And this is how you fail. If you're not able to communicate your ideas and your products that serves, it's a paradox. At the same time, you want people to learn that there's a better way of doing things, but again, you have to be having those. You have to have compulsive focusing on the customer needs and making sure that you're serving an exact need that they want, but not. It's a paradox, and that's the how you can survive.
So having the value-based idea, understanding the need of the market, needs of the customer is extremely
100%,
important. But at the same time, what is of utmost importance is you should be able to communicate your idea. It should reach the masses. People should take it and grasp it that what you are trying to sell. And apart from that, teamwork it is that plays a dominant role behind success of any venture, any entity,
100%.
right? And having the right partners, as you rightly mentioned. So if you have got right partners on board who are ready to challenge your idea, to make you realize the ground reality of your product, that's where you're able to analyze that the reality basically of your product, and having the integrity, and I guess that leads to the success of any enterprise.
True.
Wonderful. Now you have been talking about futuristic, you must have some vision. So when we talk about future plans, when you talk about the vision that you carry, so we know that at-home doc is right now there in Australia, it is there in Egypt, along with Qatar. So what future plans do you have when you talk about expansion of this beautiful venture?
So we're not claiming that we're the biggest company in this domain, but we are seeing huge potential for us to grow. We see that the primary care is the future of medicine. It's where this region is lacking. People here in the Middle East and this region, in the Arab world generally, they don't believe or they don't see the exact value of the primary care. And that's why we see great potential for us to be a major player in the coming few years, to be a major primary care provider that acts in the benefit of the patients, making them living a happier, healthier, longer life with seeing their own doctor, spending less on their healthcare, and living a healthy life. It's something that everyone would want, but how are we gonna get there without the good team, as we mentioned, or the solid steps, or the investors? It's a big project to work on, but we have the vision to be a major player in the coming few years in the primary care in this region, and not just primary care, but tech-based primary care.
That's wonderful. We wish you all the very best, and we are hoping to see at-home doc not just in Qatar, but then in many other regions around.
Sure.
It was such
That's the idea. The telemedicine is actually a boundless practice. You can talk to a doctor, and this doctor could be sitting on Mars, and you're on Earth. So it has no boundaries, and the potential is open. And the technology, if there is an interesting, there are interesting studies that's showing that the healthcare penetration in the market is in the globally, it's about 50% of the population have access to healthcare. However, 65% of the population have access to mobile phones. So there is a deficit of 15%, which is about 1.5 billion people who can access healthcare through their phones. Other things that technology is adding in this domain is the accuracy of diagnosis, and the cost associated. You have to know also that some people, they tend to neglect their symptoms because they find it hard to go to a doctor, or they're lazy about it, or they don't have the money to spend on it. However, this impacts your treatment costs, because the time spent from the arise of any of the symptoms till the time you sit with a doctor and start manifesting your symptoms to a doctor can increase the cost of treatments 10 times.
Yes, certainly.
And it could be life-threatening in some conditions. So having this accessible solution at the hands of everyone will definitely have a big impact and huge impact on how much we spend on healthcare and how much we live. So technology is adding a lot in this aspect, as well as the accuracy of diagnosis. Having That said, it's not only about offering the access at the palm of your hand, or at the push of a button. It's about how it works on the back end. Human tend to make mistakes, and it increase in remote areas. So the accuracy of diagnosis reach up to 30% only in some remote areas, where at the most advanced systems, such as in the UK, NHS could reach up to 80%. So from the first visit of a doctor. So this is how technology had a room to improve the accuracy of diagnosis, and we believe in those potential that we have an opportunity to grow in this direction as well.
Certainly, primary healthcare is one such area which is of, that's a basic need.
It's
a
basic needs,
yes, that's very true.
with a huge potential.
Yeah, and with everything becoming digital now,
yeah,
everything readily available to you at your fingertips, at your doorsteps.
Yeah.
This innovation happening in the field of medical science,
Yeah.
I'm pretty sure it's going to be amazing, brilliant. And thank you so much, Hesham. It was such a
Thank
great
you very much.
pleasure
Thank you for having
a
us.
conversation with you and
Likewise.
knowing more about at-home doc. We wish you all the very best.
Thank you. Thank you very much for having us. Thank you.
So guys, I was in conversation with the CEO and founder of At Home Doc, Mr. Hesham Elfeshawy. So if you're looking for any of the primary healthcare services at your doorsteps, the one-stop solution is At Home Doc. All you need to do is to download their application from Google Play Store or Apple App Store, and you can avail all the services offered by them. This is Anshu Jain, your host for the Startup of the Month, signing off for now with the promise that I'll be back again with another interesting episode very soon. Until then, stay safe, stay healthy, and most importantly, don't forget to follow us on Instagram, Facebook, and Twitter, that is Qatarday. At the same time, subscribe to our YouTube channel, that is Qatarday, and for daily news and updates, keep visiting our website, qatarday.com. Thank you.